have an Office of Women's Health at FDA. I don't know how many of you are aware of that, but we are now about to celebrate our 20th anniversary. And it's really women's advocacy that brought this about. I would love to say it was the brilliance of my colleagues at FDA, but that would not be accurate. Women's groups in 1992 realized from a GAO report that many of the products that were being used every day to support our health were not being tested on women. In 1994, our office was established, and our office was established to do two things. One was to look at sex differences, to promote the review and inclusion of women in clinical trials, and it was also to look at gaps in knowledge about conditions that disproportionately affect women. And then later, added to our list of responsibilities, was to educate women about the products that FDA regulates. Well, we got a little smarter and figured out maybe we should have some priorities. And so we identified a number of them: cancer, diabetes, cardiovascular disease. And over the course of the many years that we've been in existence, we now have almost 300 publications that have come from that research. And so we are now in the process of reviewing all 300 of these, as well as continuing to give specific project money out. And we will be having an end of the year meeting where we will roll out some of the information that we've learned. In addition to that, this is becoming part of what we are calling our research roadmap. Our research roadmap for the next 3 to 5 years will consist of the information we've learned from this process. It will look at the gaps in what we have not studied, and then we're also looking at each of our center's priorities: drugs, biologics, devices, as well as NCTR's background materials. And we're going to look for opportunities to promote women's health, and that's the way our money will be directed in the future.
Please visit us at drugtopics.com, join us on Facebook, and follow us on Twitter.